Today we wanted to talk a little bit about flare-ups of pain and what that means to you while you're doing exercise. It's not uncommon during introduction of new exercises or new activity that you will get some discomfort from time to time. And it's understanding whether that discomfort is bearable, whether you should just push on, or whether the discomfort's a problem and you need to pull back. And that uncertainty is often something that will stifle people's progress when they start a new undertaking. If you're not sure whether or not something's okay to continue or not, then typically, rightly so, people will stop what they're doing. When it comes to chronic injuries like osteoarthritis, it's really important to recognize that there's always going to be some ebbs and flows of discomfort. Little things in your day, in your routine, your sleep, your hydration, your nutrition, your activity, all these things can add up to slightly aggravating your knee a little bit or not feeling anything. They can impact how you move on a day-to-day basis. And so there's lots and lots of variables that can impact whether you're in pain. So just because something hurts doesn't mean that it's always going to hurt, and even more importantly, it doesn't mean that it's making things worse. So how to recognize that? Well, if you think back through time, let's say you think back over a 6-month period. Over that 6 months, have you had discomfort that's come and gone? You've had good times, bad times, good times and bad times. If that's the case, then if that was to continue while you introduce exercise, then that's probably not going to be such a big problem. If you can still move around, you can still do your day-to-day activities, then that's not such a big concern. However, obviously, if it's really limiting what you can do, you either can't bend your knee properly, you can't weight bear on it, then you should get that checked. No doubt about that. But understanding, is this something that's been happening anyway, and now that you're focusing on your exercises, it's sort of highlighted that you are a bit of an ebb and flow in terms of discomfort. Now, if that's the case, it's important to just pull back a little bit, dial things down. You don't need to stop completely, you just need to slow it down a fraction. Work in a range that is comfortable for you to do so that you don't feel like you're making things more irritated, to slow that recovery process down. But you should definitely keep moving. It's really important to keep the blood flow, keep the fluid moving, keep your lymphatic system clearing out the fluid. The muscles working acts like a pump to help clear some of that inflammation. So the more you move, the quicker you'll bounce back. A simple way to gauge that is to think of it about out of 10. Anything beyond a 5 out of 10 in discomfort is probably going to be a little bit too much in the early stages. So keep it to a 5 or less. If you can do an exercise and you can rate it as a less than 5 out of 10 discomfort, then carry on. If it's more than a 5 out of 10, then just put it to the side for the time being while the pain settles down, and then reintroduce it on the back of that. The other thing that you want to do is be able to identify if something is more of an acute problem. So if something is, you feel something click or pop or crack, and it's an unusual sound, it's an unusual sensation, it's not something you've had experience before. If you get any big, obvious swelling, or if you have trouble weight bearing, then you should definitely go and have that looked at. Pause what you're doing temporarily while you get it checked by a trained healthcare professional to appraise whether or not there's anything concerning going on, or whether you can just carry on. From here, what we're going to do is focus on those chronic problems. So the ebb and flow of arthritis or of knee pain, trying to give you some strategies for all of the different movements that we go through: squat, lunge, step, balancing on one leg, and so forth. Giving you some strategies to deal with those movements when you are in a slight flare-up of discomfort. The things that you can do on top of that to kind of help manage the flare-up are your standard approaches. If you respond well to ice, use some ice. If you respond well to anti-inflammatory, you can use anti-inflammatory under the direction of your doctor. But primarily the key is to keep moving, keep using it, and it'll settle down relatively quickly.